This exercise is called the quad set. You'll be doing this exercise before, during, and after surgery. What you're going to do, Amy, is just straighten your knee as much as you can on your surgical side. Pull the toes back towards you with a towel underneath your heels so that the back of your leg is free floating. You're going to hold this contraction for a count of 6 seconds and then relax. Go ahead and do the quad set. Hold, count of 6 seconds. Excellent. This exercise is called the prolonged extension stretch. If you're having trouble getting your knee into full extension, you may be asked to put a large towel roll underneath your heels and just let your knee relax into the extension position. You'll work up to 15 to 30 minutes for this exercise. This exercise is called the straight leg raise. What you're going to do is bend the knee of your non-operated leg. Then with your operated leg, your toes go towards the ceiling, tighten your stomach muscles, and lift your leg only as high as your knee. No higher than this. You're going to hold for a count of 6 seconds and then slowly relax down. This exercise is done for both the hip and the knee replacements. However, if you're a hip replacement, you may need some assistance by a family member or a coach during this exercise. So Amy, go ahead and tighten your stomach muscles, toes towards the ceiling. Lift up only as far as the other knee, hold for a count of 6 seconds, and then slowly relax down. This exercise is called the heel slide. What you're going to do is lay flat on your bed and just simply slide your leg up as much as you can to bend your knee. Hold for a count of 6 seconds and relax down. You're going to be careful to make sure that your knee is pointed towards the ceiling. Amy, go ahead and do a heel slide. Knee towards the ceiling. Really feel that stretch. Hold for a count of 6 seconds and then slowly relax down, nice and slow. Very good. This exercise is called the ankle pump. It's very simple, but it's very important. All you're going to do is pump your ankles back towards you and away from you as far as you can go. Just like that. You should practice this before the surgery, but after your surgery, during your stay in the hospital, you should be doing this exercise 10 times every hour that you're awake to keep good circulation in both of your legs. This exercise is called hip abduction adduction. When you're doing this exercise, lay flat on your bed or a mat and make sure that your knee and your toes are facing towards the ceiling. Don't lift your leg up off the mat or the bed during this exercise. You're going to slide your leg out to the side and then slide it in slowly in control. Okay, Amy, go ahead and do the hip abduction adduction. This exercise is called the gluteal set. What you're going to do is really squeeze your buttocks muscles together and hold for a count of 6 seconds and relax. When you do this exercise, your body will raise up slightly, and that's how you know you're doing the exercise correctly. Amy, go ahead and squeeze your buttocks muscles as tight as you can. Hold for a count of 6 seconds. Don't forget to breathe. And relax. Good job. This exercise is called the short arc quad. You'll do this exercise before, during, and after surgery for both the total knee replacement and the total hip replacement. Amy, what you're going to do is straighten your knee as much as you can and pull your toes back towards your body. Hold for a count of 6 seconds. 1, 2, 3, 4, 5, 6, and then relax down. If you'll notice, Amy has a rolled up towel underneath her legs for this exercise. Just find a big towel at home, roll it up, and put it underneath your knees for this exercise. Go ahead and try it again. And pull your toes back towards your body. Hold for a count of 6 seconds. 1, 2, 3, 4, 5, 6, and then slowly relax down. This exercise is called the long arc quad. You'll do this exercise sitting in a chair. What you're going to do is kick the leg out straight and hold for a count of 6 seconds. You'll pull your toes towards you. Then when you relax back down, make sure your feet are even. Go ahead, Amy, kick the leg out straight, hold it for a count of 6 seconds, and bring it all the way back down. This exercise is called the prolonged knee flexion stretch. What you're going to do is find a comfortable chair and bend your operated leg back as much as you can. Then scooch forward towards the end of the chair to get a really good stretch at this knee. You're going to hold this stretch for 15 to 30 seconds. Then you're going to repeat this 3 times. This is a little different than the other exercises because we want a prolonged stretch at the knee. So go ahead, Amy, bend the knee back behind you as much as you can, scooch to the edge, really get a good stretch in this operated leg. You'll hold it 15 to 30 seconds and you'll repeat this exercise 3 times.